4 exercises for lumbar sprain with Dr. Noah Volz. A lumbar sprain is an injury to the ligament, the ligaments that surround the low back bones. A strain would be damage to the tendon. The tendon connects to the muscle and to the bone. And so sprains are considered to be more serious or more difficult to treat than strains. A lot of times practitioners will group the two and say a sprain strain, but that's incorrect because they're different structures of the body, even though they're both made of collagen. So the ligaments of the low back provide a lot of stability. And so usually there'll be a clear movement that you make that will cause a sprain. And that's how you will know that it's a sprain and not one of the other types of low back pain. Thankfully, movement and activity can really help most types of low back conditions. So we're grateful that exercises to you to help you get the best results here, and so that you can really, get back to living your life and doing the things that you really enjoy doing. So a little bit more about the sprain. So as I mentioned, it's the ligaments that connect the different bones of the low back together that are affected. It's usually considered a tear in one of those ligaments, and there's different grades of tears that can happen. Since the ligaments connect the bones, they usually connect, and so the lumbar joints are also involved in a lumbar sprain. So even though the muscles aren't directly damaged when this happens, off of the times, they do have to pick up the extra work, and so they'll often spasm or do some sort of protection of that area in order to keep the low back stable when this happens. Sprains are most often diagnosed based on the history. So the type of action that you're doing, the type of pain that you felt when you were moving. But there are a couple tests, orthopedic tests, that we use to determine if it's a lumbar sprain. And these are the slump test and the shear test. So there are a few imaging modalities that can be used when it is a sprain. Soft tissue, so ultrasound, MRI, CT scan can be helpful in this case. But sometimes people can actually have a sprain or a strain of a muscle and actually have no imaging findings. If you've ever been in the medical system, oftentimes you'll still have pain even though there's no findings on imaging. So there's usually pretty poor correlation between imaging findings and your experience of pain. So imaging can sometimes be helpful, but it's not always helpful. So the 4 exercises that are recommended for lumbar sprain are the cat-cow, the hamstring stretch, the kneeling psoas stretch, and the side bridge. As you go through these exercises, there's 5 key components. One is awareness, so stay present, don't be distracted. Breathe, keep the breath full as you move through the exercises. Feel engagement through the whole body, even though you have a condition of the low back. You want to stay focused in the whole body from hands to feet. You want to feel like you're efforting, like you're working as you're doing this, but you don't want to push yourself too hard or too soon. Also, as you're aware, be careful. Don't do anything that doesn't feel right. So cat-cow directions, you're on all fours. Weight is distributed evenly between the hands and the feet. The spine is neutral. And then as you exhale, go ahead and round the low back, lifting the low back up towards the sky, tucking the chin in towards the chest. And then as you inhale, arch the spine, head comes up, and then moving back and forth through this or holding each of those positions. The hamstring doorway stretch, you're on your back inside of a doorway, and you're going to bring your one knee towards your chest and then begin to lengthen that leg up the wall adjacent to the doorway. When you get to the top, if you want to increase the stretch through the back of the leg, you can gently bring the toes towards the head, dorsiflexing the ankle. Next is the kneeling psoas stretch. So you're in a kneeling position with the hips overneath the back, over the back knee, and the front knee over the front ankle. And then you're going to gently shift the weight slightly forward into that front foot, allowing the knee to come over the toe slightly and feeling a stretch through the front of the thigh. If you're not feeling the stretch through the front of the thigh, you may want to drop the tailbone down towards the earth, flattening the low back slightly to get more of a stretch. Last is the side bridge. This is the easy variation of side bridge. So you're on your side, on the forearm and the sides of the hips and the knees. And then you gently push yourself up. So lifting the hips up in line with the shoulders, holding here, or doing sets. So those are the 4 exercises. The number of sets and reps that you do will depend on you and what's right for you. You can do 3 sets of 10 if you'd like, but really you just want to feel like you're doing 60 to 80% of your maximum capacity with the exercises. So you feel like you're pushing yourself, you feel like it's challenging you, but it's not too challenging. And remember, in the clinic, these exercises will change over time. We'll find something that you can do, but then we'll keep changing it and varying it, adding more weight, basically like gamifying it so that you continue to get better and continue to learn. And that's really the benefit of coming in to the clinic or seeing me, is that I can really help you continue your progress so you don't feel like you're kind of stuck, and we can continue keeping you healing and moving and staying strong. So the way that we do this is by resetting the system, reinforcing the system, and retraining the system. So these 4 exercises are part of the retraining to build strength and increase stability. The reset is where we try and break the pattern of pain, and that's usually massage or adjustments or other modalities that can break that pattern. And then once the pattern is broken, we want to reinforce a better pattern, and that could be through improved sleep or posture, managing your stress. So that's the general approach that's used here. So I really hope that these 4 exercises can give you the relief that you're looking for. You'll usually feel immediate results, or at least feel some improvement in the first 7 days. If you're not feeling improvement in the first 7 days, you're going to definitely want to schedule with a healthcare provider and get a second opinion to see what's going on and what you can do to start moving in the best direction. Sprains do take a long time to heal, so but you want to feel some gradual movement in the right direction immediately. So thank you so much for watching, and I look forward to seeing you in the clinic.